Hello, it is such a pleasure to be here today to share my WomenLift leadership project, which is titled Strengthening Readiness for Breast Cancer Clinical Trials in Tanzania. My name is Nashivai Kivuyo. I came into this program wearing many hats. First, as a surgeon who cares for breast cancer patients at Muhimbili University of Health and Allied Sciences. I'm also an academician and clinical researcher where I carry out the role of mentoring the next generation of doctors and surgeons. I'm also the Secretary General of the Medical Association of Tanzania, where I use this hat to advocate for equitable healthcare across all the country, especially in the underserved areas. And last but not least, I am a wife, daughter, and sister who is grounded in family, community, and the responsibility to serve with compassion and integrity. So what's my leadership project about? My focus of my project is on breast cancer clinical trials. And the aim of the project is to build institutional readiness specifically for breast cancer clinical trials in Tanzania. The plan is to adapt and apply a breast cancer relevant trial readiness toolkits across multiple institutions in Tanzania, and then use those findings to launch the first breast cancer clinical trials at Muhimbili National Hospital and Ocean Road Cancer Institutes in Dar es Salaam, Tanzania. Why did I choose to focus on breast cancer? It's because breast cancer is one of the leading causes of cancer mortality in Tanzanian women and also women across the globe, but also in sub-Saharan Africa. Throughout my practice, I see a lot of patients with breast cancer. Most of the treatment that we used comes from evidence from high-income country settings. And we are now realizing that in some cases, the treatment that has proven effective in high-income country settings not necessarily can become effective in low-middle-income country realities. So there's an urgent need to generate evidence that can guide us on how best we can treat women with breast cancer. And so there's a need to conduct a readiness gap identification so as we can properly launch breast cancer clinical trials that are going to inform our practice. My progress so far is that my leadership project transitioned into a PhD. I came into this program with just a concept and idea on what I want to do, but through the growth through this project, I was able to convert it into a PhD concept and even secure funding for PhD training in clinical research that is going to focus specifically for this project. This funding will ensure sustainability, protected time, and full implementation pathway. It also pioneer the trial protocol development and rollout through training and capacity building. My progress is that I have completed clinical trial training in India that was focused on pragmatic trial operations, specifically in low-middle income countries. And currently, I'm also undertaking advanced training in clinical research at the University of California, San Francisco, where I'm also developing the clinical trial protocol. This is part of my PhD, but it also solidifies my competency in being able to complete this project and build a clinical trial platform that will cater for breast cancer patients, but even other cancer patients in the future. I've also established a clinical trial working group in partnership with partners from the University of California, San Francisco, under the Global Cancer Program. The next step is to use the developed breast cancer trial protocol that I'm developing as the operational roadmap for readiness for breast cancer clinical trial. Through this, I'll complete a structured readiness assessment across our institutions and synthesize the finding and deliver targeted capacity building to close the identified gaps. Hopefully, after this is done, I'll be able to launch and implement a breast cancer clinical trial in my institution. Throughout my leadership journey, I am embodying the 4 pillars of leadership, ensuring that my leadership is authentic because I rooted this project in the real needs of the Tanzanian breast cancer patients. And I'm really hopeful that this project is going to be impactful because I believe it will pave the way to generate more evidence that will direct us on how best to treat our patients and get favorable outcome. I've tried to be as inclusive as possible, ensuring that all stakeholders that will be involved have a say in developing this project, and they also shape it so that the solutions are co-created and not just imported. And sustaining momentum, I hope that within the clinical trial working group that we have developed, we'll continue pursuing this agenda and ensure that this platform will cater not only for breast cancer patients, but even other patients and even other cancer patients in the future. Thank you very much.